So again, welcome to the webinar today. Next slide, Mary. We just want to give a quick disclaimer. This one's not really going to count because we're doing a showcase on resources created by Mountain Pacific this time, but just in case there are outside presenters speaking on information, we just want to let you know that it's not always our content and it doesn't constitute endorsement or recommendation by Mountain Pacific. Next slide. For updates and reminders, we just wanted to remind everybody that next week, October 15th to the 21st, is Infection Prevention Week. And next week's It's Worth a Shot will be hosted by a couple of our in-house Mountain Pacific account managers, Lori Chikoyik and Julia Drzinski, and they will be going over some importances of infection prevention information. Next slide. And as usual, we will put a survey in the chat. We would really appreciate if you guys could fill out that evaluation for us. And also on that evaluation, you are able to give us ideas for future webinars. And we always, always appreciate your guys' input to help direct these calls that we have each week. Next slide, please. We have a poll today. How often do you utilize the Mountain Pacific website for our resources? Which this one is obviously timely because we will be going over quite a few resources in a quick fashion for you guys. Let's just give a couple more moments for people to hop on and answer the poll questions for us. I'm liking that we don't have a never, but I didn't know that there was a website is something that we definitely want to remedy for this webinar. Okay, let's go ahead and end the poll there, Mary. And we can go ahead and close that out and head to the next slide. So looks like we have some trending downwards slightly for our hospitalizations and positive tests for COVID, which is always something good to look like. Unfortunately, we still have an increase in deaths. So want to keep that in mind when caring for elderly and highly susceptible people with COVID. Next slide, please. And looking at our communities, looks like we definitely have a mixed bag here. Alaska and Hawaii have, you know, a little bit of changes, and Montana and Wyoming look at the same thing. Kind of depends on where you're at, but I do like the decrease in hospitalizations, which, you know, is good for us. Next slide, Mary. All right, so we want to thank, we had last week we did have a misspelling on one of our slides. As you can see there, that it was Samoan as opposed to American Samoa, and we just really want to appreciate the feedback so we can correct ourselves. We are human, so if you guys do see any errors or discrepancies in our slide deck, please definitely feel free to reach out to us and let us know, because, you know, going through the content and doing this week after week and having the same eyes on it, sometimes we just miss stuff. So we just want to take the time to say thank you for correcting us, and we apologize if anybody was offended or bothered by that mistype, but it is corrected. So everything that's online now has been corrected. Next slide. I am going to pass this off to Larissa, who has kindly stepped out of a conference that she's attending to give a quick little shout out about some of our resources. Larissa, are you familiar with this resource?
Yeah, so I think I can just really briefly talk about, so I think one of the areas that we encounter sometimes when we're having conversations out in the community and with our partners, there's still some misunderstanding as to Mountain Pacific's role and what it is that we do. And so the picture on the left and the right, they talk about kind of the areas of our scope of work and what our contract tells us that we should participate in the community and the nursing home measures and the coalition side. And so it kind of breaks it down into more who we are as a quality improvement organization. And so we thought, you know what, that's easy on the eye. Let's put it out there so people can become more familiar with our role within healthcare and how we can also assist you in your everyday work. So I think we can go to the next slide. So this one, I'm going to kind of make it kind of brief. I'm not, I think we have a picture coming up on the survey preparedness guide that we at Mount Pacific created. And this is a pretty new resource. Coming from a nursing home background, I remember often having the chaos, right? When survey comes in or a surveyor walks into the facility, even though we think we have all areas covered, all of our checklists all checked out, there's still that uncertainty of, are we truly making sure that we are covering all the aspects that the surveyors are ultimately going to be looking at? And so this resource took a good chunk of time to build as inclusive as we probably could. And it goes through pretty much all the major components of what the the surveyor should be coming to your facility asking for. And so not to say that it's all inclusive, but it is as inclusive as we thought we could do. And so this just gives you like a kind of a working guide. So if you literally take it line by line, make sure that those areas within your facility is being addressed and is being covered, that should provide you with a pretty good direction when it comes to being ready for your annual or for when you have surveyors coming in on a complaint or whatever it might be. So, and then within the resource, there's also tons of links that will take you to other resources as well. So if you're working on an area of your survey preparedness, maybe you are running into an obstacle of how do you maybe build this component or policy. So there's tons of resources within. And then there's a full page, and I don't remember exactly which page number it is on this resource, but there's literally probably 20 to 25 working links that you can click on the image, and it will take you again to those resources that should really help you solidifying. And the goal for this tool is really not to just to make sure that that you can check that part off, that you have something in place. It also helps you in improving the quality of care that we are providing to our residents, because that's the end result, is that we want to make sure that by addressing that it's positively impacting the residents. So if are there any questions about what this might look like? I don't see any questions on the chat. Looks like there is something about this. There's an error message, so we'll work on that. It is nursing home specific. Saying that, I think that if you're looking through a different lens when you're looking at this, the survey preparedness, it might also give you direction if you're working from a hospital setting or from assisted living setting. What the surveyors are looking at, it might be a little different, but it definitely will give you some resources for your facility as well. And thank you, Holly, for you addressing that. So we'll make sure that when we send this out to with our follow-up email, we will make sure that the links are all accurately working, okay?
And then I did throw it in. There's a link that I throw in for all of the quality improvement nursing home resources. That survey readiness is actually under the regulatory resources. It's the very first one. So if you guys are looking for that right now during the call, go ahead and use that link, and then we'll make sure that the link directly to the item is updated.
Thank you, Jamie. Awesome. I will go ahead. We go to the next slide, please? All right, so I'll pass this on to Kyla Newland, our PharmD. She's going to cover some information regarding immunizations.
Thank you, Larissa. We can go to the next slide. We just came out with 2 nice resources kind of for fall vaccine season with different themes that you folks might find useful. The first one is a football themed, and this is kind of a Mythbusters, and it's looking at not just one vaccine. It's not just looking at COVID, it's looking at COVID, pneumonia, and influenza vaccines, and kind of answering some Mythbuster questions. So we've got this one, and then on the next slide, we have a Halloween themed one. Don't fall for a trick this season, treat yourself and get vaccinated. So I think these both turned out really well. And could be nice to distribute to folks in your facilities. We can go to the next slide. This is one that when we were looking at vaccines for diabetic patients specifically, and the fact that they're recommended to get additional vaccines, that there was not a resource really out there that was really nicely presented. And so Mountain Pacific decided that we would create our own. So this is another one that you can help educate your diabetic residents or diabetic patients using this handout. The screenshot is only the top portion. There's a lot of more additional information if you are able to access the resource. We can go to the next slide. So this is another nice resource, and we're proud of this one, especially because this was the first resource that we were able to get feedback from our patient and family advisory council as to how to make it most appropriately communicating what we wanted to say to patients. And this basically just talks about patients that are higher risk for pneumonia that might be age 65 and younger and have other conditions where they need to get that vaccine a little bit earlier. We can go to the next slide. And then this form is something that we co-produced with Farm 406. And this is a form to help basically let residents or family members of residents approve them to get all the vaccines that are indicated for them. So it's a universal form for a standing order that when these vaccines are appropriate, you can go ahead and administer them instead of individually filling out the form for each vaccine. And we go to the next slide, I think is the second page of this resource. So feel free to definitely use this in your facilities. And on the next slide, I think I'm going to turn it over to Shay, who's going to talk about our tracking dashboard.
Yeah, thanks, Kyla. Just one thing, Mary, if you wouldn't mind backing up to the last slide real quick, sorry. We've had some facilities ask about this form and the one below. I just wanted, or the one previous to this, we just wanted to make sure that you guys are aware that upon admission, the first page should be filled out, this one, and then that will be your standing form. And then the second page will be when you guys go to give your boosters or when you have another vaccine given. So I just wanted to add that piece on there because I think some facilities were, even myself, were kind of confused about that. So next slide, please. So Mountain Pacific has developed this dashboard that is quite full of resources. And if, I don't know, Mary, do you want me to share my screen or do you want to click into it? I'll screen share here. Okay, can you guys see my screen? Okay.
Yes, we can.
Okay, thank you. So as you look at this form, it goes through and you can do your vaccine dashboard, and it is nursing home specific. But if you look at it, you can see that you it'll do all the vaccines, not just COVID. So it'll go through and it will calculate your data for you and create all of these nice fun graphs. So as you add in your numbers, you should be able to see, you know, especially with this one, for example, this was for the bivalent booster. So you can go through and kind of track your changes. So that's kind of a fun, unique, I guess, source that Mountain Pacific has put together. And again, the home screen will look like this. So this will also take you to the Centers for Disease and Control and Prevention as well. So again, this is a great tool to kind of keep all of your information all in one. So we're pretty proud of this one. And then I will go ahead, if it's okay, the next slide we have here. We did develop some of these care coordination tools for everyone. And this is a great one to identify when we're having issues with transferring back and forth and discharging. You'll go through, this is a great transfer checklist that we've developed. And it goes through all of the key aspects that you guys would need to do upon discharge. So we just like to make sure that we're providing you with a clear, concise document to allow you the ability to transfer, discharge, and keep kind of track of your residents as we go through that. Okay. And the next slide the next one I wanted to highlight here is the patient readmission interview tool. And this one is one of those that we're identifying that going back and forth to the hospital has been quite problematic for a lot of our nursing homes. And so here is a tool that can help you kind of revisit that, especially for the reason for returning to the hospital, kind of doing a QAPI, so to speak, on that revisit. And you can address this with your care team and in your QAPI meetings as well. It's an excellent tool to kind of revamp or revise, revisit that admission. The next one we have that I wanted to highlight as well is to reduce your risk of hospital readmission. Again, as you see, there is quite a focus on those readmission rates. So we're just trying to help you develop some resources and to pass out, a few easy things that you guys can use in your facilities. So again, there's this one you can give out to the resident and their families. So you have a discharge plan for the initial hospitalization. And then again, just as a reminder, a list of all medications. We do see that that is problematic when looking at maybe a readmission back to the nursing home. So we just want to make sure that your residents are discharged and know their appropriate medications and what they're taking. So just again, a nice little reminder for you guys. This one is another toolkit that you guys can use. So it's actually quite comprehensive, but we spent a lot of time on it. It'll go through and walk you through some of the major complex or options here for your readmissions. So again, it'll give you all the definitions. You put in all your data. It's pretty straightforward. And then, again, a lot of it's just one of those things that's going to point out where all this information is coming from. You can adjust some of these days of the weeks, the time blocks, again, your ages. It's going to calculate all this for you. And then it'll create all these nice fun graphs for those of you who are visual or your medical directors or visual creatures as well. Sometimes that does help. And then the last one I wanted to go over with you guys is kind of reducing the avoidable ER visits and hospitalization toolkit. So again, another great resource for you guys to look at. We're really trying to focus on the root cause analysis for why we are admitting to the hospital or why they are going back to the emergency room. So again, just another great resource for you guys to take a look at in the event that you would like some more documentation. All right, and I'll stop sharing for my last slide. Mary, if you wouldn't mind. The next slide. These are the links, and this is the last one. The head-to-toe assessment was a quite popular document that we shared out at the last nursing home conference. And again, this one can be laminated, cut in half, so you have the cards with you. As we're seeing that nursing assessments are always something that we can always improve upon. And it actually was something that we identified in a lot of our facility visits, that this is something that would be helpful. So again, another great resource for your nursing homes and your nurses to use just to help their job. So with that, I will go ahead to the next slide and pass it on to Lori.
Hi, next slide, please. It's great to be with you guys today. It's a great day to just highlight a lot of these resources. So I'm just going to continue on with the theme here. We have a great resource on sepsis awareness for our nursing homes. It is a nice zone tool. We want to be prepared to prevent sepsis. And so knowing the signs of sepsis is a great way to do that. Prevention's always key. Just a reminder, and I know we focused on this earlier in the year, two top ways that residents are getting sepsis when they are in nursing homes include respiratory illnesses and malnutrition. So make sure that you have good respiratory etiquette practices in place and make sure you eat and drink well. So enjoy. If you haven't gotten that tool yet, please download it. Next slide, please. And then this is always popular, our top 10 infection control deficiencies. We took a look in our area for the top 10 reasons people are getting cited with infection control deficiencies. And it not only has the deficiency, it has the remedy. So a really great tool to help hopefully prevent infections in your facility as well as prevent tags. Next slide, please. And recently the CDC developed something called enhanced barrier precautions, and it has created some confusion among our nursing homes. This is designed specifically for nursing homes to prevent the spread of MDROs. So this is a simple comparison sheet comparing enhanced barrier precautions for transmission-based precautions. So it's just a side-by-side with several differences that may just kind of succinctly help you identify ways to apply those in your facility appropriately. So those are the 3 resources that I was happy to share, and I'm going to turn the time back over to Kyla, who's going to share some more resources.
Thanks, Lori. We can go to the next slide. I'm going to just show a couple resources related to pain management and medication safety. So the first one being a how to use your medication list. Very important for patients to keep an updated list on their person, as well as reporting it all to their healthcare providers. So this is just a nice tool. This is only the first page. Again, the second page has a list where you put each of your medications and what time of day you take it, etc. We can go to the next slide. This is a really cool tool that we developed that looks at alternative pain management approaches. So included in this guide are things like massage therapy, exercise, behavioral health approaches, like cognitive behavioral therapy, psychological approaches, other complementary methods like acupuncture and Tai Chi, yoga. And in each section, this document is 5 pages. It has a link to kind of all the research that's behind each one of the approaches, which is really nice. So I'd encourage everyone to take a look at this, this resource. You can go to the next slide. And actually, can you go back one? We have a flyer for naloxone. So this is just a kind of a how-to guide. This can be printed out and folded as a tri-fold document as well, with some QR codes to go to some trainings for naloxone as well that are available online. And last but not least, on the next slide, we do produce a bulletin on a quarterly basis, and these are the topics that we've covered so far in that bulletin. That bulletin and all of the previous episodes, I guess, can be found on our website under the nursing home link, which I will put, and then if you go under opioid stewardship, that's where those are going to be located. So take a look at some of those past editions and look for future editions that we send out on our listservs. And with that, I will turn it over to, who's up next? Jamie.
Well, hello, everyone. Since we are short on time, I'm going to get through the chronic disease management resources kind of quickly. The first 3 of them are going to be for our residents. So, Mary, if you want to jump to the next screen. This is a disease tracking tool that we have, or a zone tool that we have. And Mary, if I can share my screen really quick, I will just show everyone that. There we go. So this is it, and it just kind of gives you between green and yellow and red if they need to get a hold of just their provider and ask some questions, or if they actually need to go in to the hospital. And then the next screen is actually going to be for, make sure I'm not jumping slides here. There we go. There we go. For cold medicine. And that, Mary, if you want to take it back for just a moment. So it's kind of a good guide for our residents to have a reminder of what to look for as they're trying to get some cold medicine, especially this time of year. There's that. Sorry, I'm trying to scoop through these so we don't keep anybody longer past time. And then next slide, Mary. This is a tracking tool that can be printed front to back, and on the back side has dates and times available spots along with what their blood pressure is. So they can print that out, or we can give them out to our residents. And this is more for our short-term care or residents who want to have a little bit more ownership of their care plans. And then next slide, Mary. And this is more for a good reminder for everyone. We all take blood pressure measurements day in, day out, but sometimes we kind of get in the groove and forget some things. Or if you've got new aides or new CNAs that just kind of need a reminder of some of these items, that's a good resource to have. And then next slide, Mary. And everybody's favorite, emergency preparedness. Next slide. So after COVID hit into 2019, the CDC went through and updated the guidelines that they recommend different facilities to have. So this guidance will help you kind of have considerations for emerging infectious diseases versus the full-blown emergency plan, which I will go over here in a moment too. I know we're at time, so if we need to cut off early, let me know, Miranda or Mary. If you want to just jump to the next slide. So these are flip charts, and it's something that you can just keep up front for either staff or residents to go through. And then next slide, Mary. And this template is one that I really enjoy. It kind of helps you go through and not only have a plan in place, but help build policies from anything from a medical emergency to a chemical spill to severe weather, and even a little bit on a cyber threat, especially with how things are going more towards technology and having information at your fingertips. This will help give you get a plan in place for that type of situation. Next slide, Mary. And we also created a after action plan guide It just kind of, the purpose of this is to do a debriefing meeting to identify any gaps in the processes or procedures, so that if something were to happen, you know you'll have all of your bases covered. And that is it for mine, if anybody has any kind of questions. All right. Well, since we are at time, I will go ahead and wrap us up. If anyone has any questions, please feel free to reach out to any one of us, or put your questions in the survey, which Mary did put in the chat earlier. And we thank you for your time today and bearing with us as we had some technical difficulties with our links.